growing up in an area, unfortunately, with not a lot of opportunities. I went to a high school that was 5,000 students and only 250 of us graduated. Because of how my parents grew up, they had always instilled in me, you're going to be a professional, right? And so it was either be a doctor, a lawyer, or a police officer. And I was like, that's an interesting combo. Unfortunately, one summer, my mother-in-law became ill. So I was blessed to be able to be with her in the hospital during her hospitalization as well as her rehabilitation. And that's where I realized, I'm going to be a nurse. And I'm a nerd. I love reading. Mm-hmm. And so I was like, that's it. I'm missing a book about me for me. So I spent one night, looking at all the databases, and I was like, okay, where's the books about Latina nurses? But I didn't find one for Latina nurses. And so that's where kind of the dream came about. All right, there's not a book out there. I'm going to make one. Latinos in the U.S. in nursing, we only make up less than 8% of the registered nurse workforce. If you look at leadership in academia and practice, it's even lower than that. And so as Latinos, Latinas, Latinx, Latinx, our numbers continue to increase. Yeah. It's vital that we are represented in these critical services.
Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Nello. Every week, I'll be joined by a nurse who is reshaping the narrative. From frontline care to leadership, education, innovation, and beyond, our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time. Welcome back to the Nurse on Purpose podcast. Today, I'm honored to have yet another powerhouse in nursing and advocacy joining me. Dr. Tina Loarte-Rodriguez, or as she calls herself, Doctora Tina Loarte-Rodriguez, is a doctorally prepared nurse leader, advocate, and innovator. Dr. Rodriguez is on a mission to champion health equity, patient safety, and community impact. She's also the author of Latinas in Nursing, an inspiring anthology that amplifies the voices of Latina nurses and highlights their invaluable contributions to healthcare. So it's a pleasure to have you on the podcast today, Dr. Rodriguez.
Nello, thank you so much. The honor and pleasure is mine. And please call me Tina.
Yeah, thank you. Okay, so today we're really going to just be diving into your advocacy for health equity and your passion for uplifting Latina nurses and why representation in nursing matters now more than ever, especially as a Latina yourself, being passionate about how Latina nurses are represented and portrayed and giving them a voice in the public. So let's start off by, just talking about your journey in nursing. How did you end up becoming a nurse? Give me that whole spiel.
Ooh, how much time we got? Time we got?
We got all the time you can give.
So I am born and raised in the Bronx, New York. My parents are hardworking, but didn't have the opportunities and privilege of going on for higher education. So they were working class. Sometimes, many times in my childhood, we were on public assistance. And so growing up in an area, unfortunately, with not a lot of opportunities that were available for the community. I went to a high school that was 5,000 students and only 250 of us graduated 4 years exactly. Wow. So it wasn't really a high school. It was like a daycare just for teenagers.
Oh my
yeah. But in that, thankfully, my parents instilled in me the power of education and how that's something that could never be taken away from you, as well as the power of kindness. So those are two values that I've been able to carry on through my entire life. And I'm instilling in my children, as well as all of those that I connect with. But because of how my parents grew up, they had always instilled in me, you're going to be a professional, right? And so it was either be a doctor, a lawyer, or a police officer. And I was like, that's an interesting combo. But all right, I could argue and I like to talk back, right? So I was like, maybe law would be interesting. But then in high school, actually early on, I had an affinity for math and science. So then I was thinking, all right, I'll be a doctor. ended up being first generation student at Cornell University, where I took chemistry. And chemistry told me, Tina, you're not ready to be a doctor. So I was like, all right, I hear you. And I actually was a major in human development and family studies, and then ended up doing a concentration in early childhood education. And so in that space, I just loved learning about the brain and the social aspects of humanity, and really loved being around the kids. So I taught actually for a number of years in a variety of settings. I actually did a study abroad in Sweden as an exchange student. Yeah, exactly. So Puerto Rican from the Bronx in Sweden, and I was teaching Somali refugees.
Girl.
Exactly. Exactly. Right. And so just a phenomenal experience. But I ended up becoming a member of Teach for America, a great organization that helps underserved, under-resourced communities get qualified teachers into their systems. And I did that for 4 years. Loved it. I taught middle school math. Loved being with those teenagers and preteens. And unfortunately, one summer, my mother-in-law became ill. And so I was a teacher. I was off from school during the summer. So I was blessed to be able to be with her in the hospital during her hospitalization as well as her rehabilitation. And that's where I realized, I'm going to be a nurse. So I went back to school and eventually did become a doctor nurse. As you alluded to, right, I do have my doctorate of nursing practice. So
Absolutely.
I did end up still being a doctor.
Yeah, there you go. Awesome. Dreams fulfilled.
That's
That's
right.
wonderful. And coupling that with passion. You can't get better than that.
Yeah.
Right. So, what led you to create this movement for Latinas in nursing? Like, what is the mission behind this initiative and writing this book?
Yeah. So, as I alluded to earlier, I've always been verbal and vocal. I think as early as second grade, I was doing advocacy work. I was collecting money for children in Africa. I ended up running a team for March of Dimes in high school. And then in college, got a little political with my advocacy, but always realized that there's the need to continuously ensure that the people who are impacted by decisions are part of the decision making,
Absolutely.
right? So it can't be for me without me,
Yeah.
right?
Yeah.
And COVID just exponentially, made that so
Yeah.
much
Highlighted
more
it. Yeah.
prevalent, right? And brought it to the forefront. And for me, what was interesting is that I had been really focused on my career in nursing and in my different specialties, and had kind of did not connect the pieces of nursing and advocacy that just go hand in hand. And so obviously, COVID, right, made that a huge reality for me. But in that, I was also recognizing the need for me to take care of myself, as we know, right? Nurses, unfortunately, historically, are, identified as martyrs, right? Like we give of ourselves until there's nothing else to give for everybody else, but we couldn't do that, right, in COVID, and we shouldn't be doing that. So I was during 2020, along right with COVID, we also had the social justice movement with the unfortunate deaths of, the unfortunate murder of George Floyd and Breonna Taylor and so many others who look like me and people that I love. So dealing with all of that and also trying to care for my family, my team. And also at this time, I was doing my master's in nursing. I was like, okay, there's a lot going on and I'm doing the things. I have, my COVID bubble. I had my wellness routine. If I was getting sleep, I was socializing in my bubble. I was exercising. I was in therapy. I've been in therapy since before that, but definitely was in it during COVID, and I'm in therapy now. I always like to say that proudly, to socialize it, like getting the help you need for your mental health as well is as important as your physical health. So I always love to champion that and socialize that and normalize that conversation. But I still felt something was missing. And so I was like, all right, what is it? And I'm a nerd. I love reading. And so
Mm-hmm.
I was like, that's it. I'm missing a book about me for me. So
Oh,
I spent one night, right, looking at all the databases. And I was like, okay, where's the books about Latina nurses? I identify as Afro-Latina. So I was also looking about books on Black nurses. And I found a handful of those, but I didn't find one for Latina nurses. And so
mm,
that's where kind of the dream came about of, all right, there's not a book out there. I'm going to make one. The first one came out in 2023 and has had tremendous success.
yeah.
It sold over like 1,400 copies. Yeah,
Wow.
yeah. And I just looked at that number the other day and I was like, wow, and
Mm,
that's really like passive because I have my full-time job still that I'm doing, right? I have my
yeah.
kids, my family, all the
Yeah.
other stuff that I'm doing.
Yeah.
And so just from the need, right? And the
Mm,
organic permeation of the work going out into the world, over 1,400 copies have been sold.
wow.
Which prompted me to then do the next one, Latinas in Nursing Volume 2,
Yeah.
which came out in 2024, but also because I didn't put my story in the first volume.
Right.
I,
I
I was like,
noticed
oops,
that.
I was like, oops, I forgot to put my story
Yeah.
in.
Yeah.
But since then it's grown. I'm
Hmm.
actually working on the Latinos in Nursing
Awesome.
series now,
Awesome.
as well as have plans for having an LGBTQIA in nursing.
And I'm a proud owner of that
Yeah.
volume. Such a wonderful read.
Thank
Honestly,
you.
one of the things I love most about the book is that really, in addition to telling their stories of their journey, whether they were immigrants, or second
Mhm.
generation or first generation to go to college, you also allow people to highlight what it is that they love about nursing. And I feel like that's not commonly seen today, where most of the voices you hear are, burnout,
Mhm.
bullying, incivility, dismal looking nurses. I love that people were able to say, this is what I love about nursing. And whether it was the depth of connection that they felt with patients
Mhm.
or something like a sacred call, that they felt to the profession. Dr. Paul, Valerie Joseph, and I think it was Mimi Gueracocha.
Yep.
Those two really like stood out to me. And I really loved how they interwove faith into their profession and how their faith drives them to provide the care that they do. I'm really impressed and I'm glad that you wrote this book
Thank you.
because people might say, Latina nurses, Black nurses, white nurses, like we're all nurses.
Mhm.
Why is it important to highlight the voice specifically of
Mhm.
Latina nurses? Can you
Yeah.
speak to that?
Oh yeah, definitely. And I appreciate you calling out Pole and Mimi's contributions to it.
Yeah,
And again, echoing the importance of celebrating what we still love in nursing, because
yeah,
it's right, it's not the narrative often that we hear.
yeah.
But the criticality of this movement, as we're calling it now, right? Because
Hmm.
it's expanded from a book to a series, now to a franchise. It's also a nonprofit organization.
Awesome.
But it's a movement because Latinos make up about 20% of the US population, but there's projections that 1 in 3 people
Mm,
by 2050 will be Latino. We're the
mm,
youngest demographic in the state. We have the largest gross domestic spend
mm.
in the world. So Latinos in the US,
Wow.
right? We are making money and we're spending money,
Right.
but we're not benefiting from that. We are not in the
Right.
positions of power. In
Right.
nursing, we only make up less than 8% of the registered nurse workforce. If you look at leadership in academia and practice, it's even lower than that, right? And
Mm,
so, as Latinos, Latinas, Latinx, Latinx, people continue to, our numbers continue to increase. It's
yeah.
vital that we are represented in these critical services. And then not
Yeah.
just in healthcare, in all aspects, right?
Yeah.
Education, government, business. Another interesting fact is that Latina women are the fastest growing group of entrepreneurs. Like we're out there opening up
Do
businesses.
it.
We're doing it.
Yeah.
We're doing it, right? Contributing to the economy. And also the other piece is that we are the fastest growing voting group as well. So there's a lot of power and influence within that community, but there's not as much representation
Yeah.
in the narrative, right? In the
Yeah.
public stories. And so
Right.
this movement is a way to highlight that, to
Mm-hmm.
celebrate us, to recognize
Yes.
us, but it's
Yeah.
also a call to action,
Yes.
right? Of saying, hey, we're here.
Yeah.
We've been here.
Yeah.
Many of us are indigenous, right?
Yeah.
And we are not going anywhere.
Yeah.
We are contributing in all aspects of society, in healthcare and in nursing. So just ensuring that others with privilege and power recognize that
Mm.
and use their privilege and power to pull us in and to pull us up.
That's wonderful. Thank you so much for sharing those statistics. So what I'm hearing is that you are boosting the economy, like you have economic power, but you're not getting as much as you're giving off,
Correct.
and I understand that,
Mhm.
clearly, and, especially with the profession of nursing in general, how much we pour into the healthcare workforce
Mhm.
and the healthcare economy, but we're not properly reimbursed for that labor.
Right.
What steps do you think that healthcare institutions can take to really promote equity and support Latina nurses?
Mhm.
Because we know that celebrating diversity also helps to promote and improve patient care and
Mhm.
healthcare as a whole, right? We know that as a fact. So, how can healthcare institutions support Latina nurses? How can schools
Mhm.
help to recruit and retain Latinas into the nursing profession?
Yeah, excellent question. And, there is evidence in science that shows that when there's cultural congruence, right, between the care team and the patient, outcomes go up and
Yes.
and spend goes down, right? There's
Yes.
trust there, there's understanding,
Mm-hmm.
there is ability to connect on a more human level,
Yeah.
which is what our science is about, right?
Yeah.
Ensuring that the human in its totality is
Mm-hmm.
seen,
See,
appreciated,
validated.
validated, and then
Mm-hmm.
supported to live
Mm-hmm.
the best possible life that they want to live.
Yeah.
So my call to action is multifaceted, multi-pronged, right? But there has to be transparency, there has to be accountability.
Mm-hmm.
We know what gets measured gets done, right?
Yes.
And we know when it's on the strategic plan or on the CEO and the other chiefs and executive officers' annual incentive plan, then there's resources
Mm-hmm.
dedicated to ensuring that one, they understand the data,
Yeah.
and two, that there's actions taken to improve and adhere to the plan, and hopefully making sure that they're meeting the metrics that were established. I would say that in addition to that, there has to be a lot of honesty in understanding how mistrust has been created in these
Mm-hmm.
institutions, both in
Mm-hmm.
higher ed and in healthcare, and that organizations and institutions need to apologize for
Mm.
when they have wronged a person or a group,
Yeah.
right? Like there's this racial reckoning that's happening right now in nursing, where the history of racism in nursing is finally accepted, right? And there's
Mm-hmm.
action towards that. And so I think organizations need to be aware of that. They need
Mm-hmm.
to understand that, and they need to take responsibility for
Mm-hmm.
when they have caused and harm against a person or a group.
Yeah.
In that as well, data collection is going to be very important. And us Latinos, a lot of times people don't know how to classify us. We make up all race groups,
Yeah.
right? Some of us
Yeah.
identify as black, some of us
Mm-hmm.
identify as white, Asian,
Mm-hmm.
indigenous, native,
Mm-hmm.
and all the other groups. But more importantly, there's a large affinity of us to identify by our country of origin or
Yeah.
ethnicity, right? And so understanding that, ensuring your data collection systems are complete enough so that
Mm-hmm.
everybody feels that there is a box to
Right.
represent them, right?
Absolutely.
And to be diligent with that.
Mm-hmm.
And know that it's not a one and done process, right? As the demographics continue to evolve and change, you're going to
Yeah.
have to keep your pulse on it.
Yeah.
So, as any good nurse, as any good, process improvement professional, quality professional, right? It's the plan, do, study, act cycle.
Mm-hmm.
You have, you get your assessment, you make your, your plan, you implement
Mm-hmm.
it, and then you check it
Yeah.
and you keep iterating on that. I
Yeah.
would also say don't be in silos. Don't reinvent the wheel, right?
Mm-hmm.
Partner with other organizations,
Yeah.
national organizations. There's the
Yeah.
National Association of Hispanic Nurses, the Society
Mm-hmm.
of Latinx Nurses.
Yeah.
There's a number of other professional organizations for various healthcare professions that
Mm-hmm.
are targeted to underrepresented groups, right?
Yeah.
Utilize them and leverage their resources and their experience to help with the local initiative that you're planning.
Perfect. Awesome. I wanted to, kind of go into the student question,
Mm,
right? And I know that there might be young women, men who are looking to enter the nursing profession
mhm,
and maybe want to know what to expect.
mhm.
What advice would you give to young Latinas who are considering a career in nursing or healthcare?
Yeah, absolutely. I love that question, right? I'm an eternal learner. I love
Yeah.
school. Science and the nursing profession, right, is something that is always evolving. So
Yeah.
you need to stay up to date on best
Hmm.
practices. So this is not a profession where you think you're just going to go to school and be done, right? You're
Yeah.
always going to be constantly learning. And so I love all of that. And my advice to those who are listening, actually for any age, right? Because I was a second career nurse, and we
Hmm.
have many people that I know of now that after being in one profession for a little bit, they're like, "Oh, I really want to be a nurse," and then they're going into nursing at a later age. So I definitely recommend to anyone who has an interest in nursing, to connect with those in the space now,
Yeah.
right?
Mentorship.
Exactly. It's never too early to get a mentor. If you're active on social or on LinkedIn, right? Ensuring that you are able to connect with those people. If you don't have immediate people you can reach out to.
Hmm.
I didn't know any nurses
Hmm.
until I was a nurse,
Hmm.
right? So I didn't have that privilege. But definitely now, with social media, there's the ability to connect with
Hmm.
people. So definitely capitalize on that. I think also, knowing that, do your research and understanding the steps
Hmm.
of the different options into
Yeah.
nursing. So in my day job now as an executive director of the Connecticut Center for Nursing Workforce,
Hmm.
that's one of the things I'm always championing is like understand the different entry points into nursing, right?
Yeah.
There's CNA, LPN, RN, accelerated RN for those who have a bachelor's in something else. So there's 4 different ways that you can get into nursing,
Mm.
and then exploring what you want to do. And
Mm.
I also caution to not be caught up in figuring it out automatically, right?
Mm.
I thought I was going to be a labor delivery nurse. I never
Mm.
worked in labor delivery. When I was in the OR, I thought I was going to go back to school and become a nurse anesthetist. I never did that, right? But
Yeah.
that's okay because
Hmm.
my steps and my skills have just set me up to continue to transition. And nursing
Mm.
is so diverse. I mean, my motto is nurses belong everywhere decisions are made.
Absolutely.
And we need a nurse in the White House. We need a nurse to be an astronaut, right? To go
Yeah.
into outer space. Nurses are in business. Nurses are in policy.
I love that.
Yeah, so we have the skill set to do everything and anything. And so
Mm.
stay curious, be patient with yourself. It's gonna
Hmm.
take time, right? I didn't pass every test, right?
Yeah. Yeah.
I've made mistakes as a
Hmm.
nurse, right?
Yeah.
I've had medical errors as a nurse.
Yeah.
It is the reality. We're human, right? We are flawed. But ensuring that you are up to date with your competencies, relying on your team and your network, and your support group, using the resources that are available to you, but also being innovative, right? As
Mm.
I did with Latinas and nurses, I saw a need for something that wasn't there, so I created it.
Yeah.
There's tons of opportunities for more innovation and development within our
Mm.
profession. And so if you are curious and you want to do something that you don't see, do it. Don't be afraid to
Yeah.
do it.
Yeah. Wonderful. Thank you so much for sharing that. I do have to mention, because you didn't say this before, But your book was recognized with an
Oh,
honorable mention
it
in the
was.
Latino International Book Award. So congrats on
Thank
that.
you.
What is next? What do you envision when you think about the future of nursing, right? What is your hope for the future of nursing in the way Latinas will play a role in it?
Yeah. That we are equitably represented, right, in all
Mm,
aspects, that our expertise and our passion and our skills are appreciated, and so that there is reduced or minimized. I would love for no barriers, right? I would
mhm,
love for no barriers for us in our communities to be able to have the best opportunities afforded to us. There should be a Latina in every C suite. There
yeah,
should be Latinas, Latine, Latinx people on every board, us in political office.
yeah,
And so just really having it so that our potential, right,
mm,
is not stifled and that
yeah,
we're fully embraced and supported. Because we're pretty awesome.
yes,
We've been
you
doing some
are.
amazing things for a
You
long time.
are. Listen, if you haven't read this book, you better go ahead and buy it. Like I'm gonna link it in the show notes.
Thank
But
you.
yeah, you are pretty awesome,
Thank
and
you.
and this is historically. It's
Right.
not like Latinas just entered the profession yesterday. I love
No.
that you talked about
Mhm.
historical figures in
Mhm.
nursing over the years.
Yeah.
So thank you so much for sharing that. It is
Right.
my hope that there will be inclusivity and diversity in, of course, our nursing workforce all around so
Mhm.
that everyone's talent has a chance to shine.
Right.
So thank you. I appreciate it. All right. So we are going to transition into the
Woohoo.
fun part. Okay. So do you watch any shows? Have you watched any in the past? What are your thoughts about nursing portrayals in the media?
Oh, what show, what genre, right? Like we just got
Yeah.
this new ER, the modern ER. It's the Pit now on
Yeah.
HBO.
Yeah.
Obviously Grey's Anatomy,
Yeah.
Scrubs, right?
Yeah.
So it's funny how all these healthcare shows have doctors and it's the nurses, right? We're the love item, right?
Yeah.
Or we're the we're the ones that are causing drama. And I'm like, well, wait, that's come on. We do more than we don't do that by ourselves, and there's more to nursing that they're not portraying. So
Yeah.
yeah,
Yeah. Love to see that. Okay, so let's play our game.
okay,
You know how it goes. My
yeah.
jar is right here. I'm going to pick out a category. And you, Doctora Tina, will turn into a screenwriter of your own show, right? If you had a nurse character or a nurse lead, how would you want that nurse to be portrayed? Okay? Shake, 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 shake. I hope everyone has watched like an episode by this point because they should know what the game is about. All right, let me
I
close my
love this
eyes.
game.
Girl, pray to God I pick something good. Okay, listen, I have got a telenovela.
Yes,
Are you kidding me?
yes.
This game is meant to be. I'm just going to
Oh
tell you.
goodness,
It's
love
meant to
it.
be.
It's
All right,
amazing.
go for it.
Yeah. So I am writing the script and the storyline for a telenovela on nurses. It's going to be a strong, powerful woman, right? Who has so many intersectionalities, right? Like
Mm,
she's a human, a mom, a wife. She's a nurse, a leader, but then also showing some of the vulnerabilities in that
mm,
and showing all the hard work, right, that's
mm.
taken to get her where she's at, but also showing her determination, right, and her commitment to her patients, her staff, her community. The telenovela theme is perfect because it'll be a great way to also educate the community, right, on
Mhm.
certain health topics from the nursing perspective, right? Because a lot of
Yeah,
these shows right now are from the doctors, and yep,
yeah,
doctors are great, but right, like nurses are the largest workforce,
yes.
and we have a lot more patient care and interaction, right?
Mhm.
So showing those components of it and really showing the empathy and the communication that goes into the patient's care and building and sometimes rebuilding
Yeah,
and healing that
yeah,
mistrust
yeah,
that they've have experienced with the
yeah,
system.
yeah.
I would also love to see obviously this show is going to have a whole bunch of nurses in it. So there's going to be the nurse executive, right?
Yeah.
The nurse recruiter, the
Yeah.
nursing students,
Yes. Get it.
and nursing faculty, but
Yes.
just being able to highlight, right, the complexity of
Awesome.
our
It's
expertise
got
and
to
what
have
we
some
bring.
drama too,
Of
because
course,
I
that
mean
too, right? Of course,
it
couple love stories in there and
is.
some dramas.
Wonderful.
Yeah.
Thank you so much for sharing. That was awesome. Where can people connect with you if they wanted to reach out, buy the book, all of that?
Yeah. So I did give up social for Lent. So I'm not on TikTok or Instagram at the moment. I'm on LinkedIn because that's kind of more, I think, work related than social. But also on the website, latinasinnursing.org.
Awesome.
You can always reach out to me there.
Yes, and all of that will be in the show notes. If you could suggest anyone to be a guest on the show, who would it be?
I think you need to have on Dr. Roberto Roman next. He
Okay.
is an amazing nurse, scientist, DNP, PhD prepared, working
Wow.
in LGBTQI health down in Florida. So, he has some great experience
Nice.
and expertise in dealing with that really critical population right now that unfortunately is under attack. So I would definitely highlight him to be a guest
Awesome.
next.
Such a pleasure to have you.
Thank
Thank
you.
you so
Pleasure's
much for
mine.
joining me. This was great. Thank you guys so much for tuning in. It's been a pleasure talking to Dr. Tina today. And I hope you guys tune in for more episodes in the future. Take care. Until next time. Bye-bye.
Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.